All right, this is going to be a short video breaking down distributive shock. We're going to talk a little bit about the types, but we're not going to dig into the individual types. Oxygen is normally delivered to the tissue by crossing or diffusing across the alveoli into the blood. The heart pumps that blood through the blood vessels to the tissue where the oxygen is delivered. Then the blood returns back to the lungs ultimately to pick up more oxygen. So, what is shock? Well, shock is any time there's a problem getting oxygen from the alveoli to the tissue. Shock is broken into categories based on this system. If there's a problem with the pump, it falls into the category cardiogenic. If there's a problem with the blood, it falls into the category of hypovolemic. If it's a problem with blood vessel dilation, it falls into the category of distributive. And if all three of these are working, but something's preventing that oxygen from getting to the tissue, it falls into the category of obstructive. So under each of these categories are types. And like I said earlier, we're going to look at distributive. Now, the three main types of shock that fall under distributive is septic, neurogenic, and anaphylaxis. Now, distributive shock has another name that I like a lot more because it does a better job at highlighting what the problem is, and that's called relative hypovolemia. Now, I want you to take these jars as an example. You have one jar with about 250 milliliters of fluid in it. Let's call it almost full. If we take that jar and we pour it into a larger container, we haven't lost any significant volume, but we've gained space. So the jar that was full or almost full isn't full anymore. Our body does the same thing in distributive shock. It's a problem with the blood vessel dilation. And we get this increase in vascular real estate without an increase in volume. Now, this isn't just failure to get oxygen to the tissues. This is failure of one of our body's primary means of controlling blood pressure. That's why these patients decompensate so quickly. We also get extravascular space in all the capillaries. Now, this is what causes the flush skin in all the distributive shocks: neurogenic, septic, and anaphylaxis. Now, neurogenic might be separated by a line where the spinal injury is, and anaphylaxis may have other symptoms like a rash, but all the shocks that fall into the category of distributive shock have the flush skin because of this. Now, let's take a look at those individual capillaries and see how they're contributing to the shock. Now, normally, blood, especially in a compensated state, like say hypovolemic shock, these sphincters on the outside of the capillary beds prevent significant blood flow from going through the skin. Temperature can affect this, other medical conditions can affect this, but more or less our body constricts blood flow to the skin. In distributive shock, aside from just the vasodilation, those sphincters dilate, and this allows blood to flow through the capillaries. Now, this is occurring throughout the body. So, again, we get more vascular real estate without the increase in volume. This leaves the body with only one tool to maintain cardiac output, and that's an increase in heart rate. On top of all that, these capillary beds start to leak. So, even though this is a vasodilatory problem, we're still getting some degree of volume loss. Now, the three types of shock that fall into the distributive are anaphylaxis, and that's driven by the IgE molecule attacking what it sees as a harmful substance, where the sympathetic nervous system distal to the spinal injury is unopposed by the parasympathetic. Now, if you're confused about the sympathetic and parasympathetic, I'll include a video we did on the sympathetic and parasympathetic at the end of this video. Now, one noteworthy difference with neurogenic shock is because the parasympathetic nervous system is now in control, you'll see normal to low heart rates, unlike the other types of distributive shock where you have that chronotropic response to maintain cardiac output or an increase in heart rate. And the third type of shock, like we talked about earlier, is sepsis. This is just the body fighting off an infection. We also have another video going into a lot more detail on all the categories and types of shock. I'll include that in the end screen as well. But until then, you guys be safe.